So good morning, friends. Today we are going to say one more important topic of introductory part of homeopathic materia medica, that is basic terminologies of homeopathic materia medica. Then why I have selected this topic? There are certain objectives behind this that we will also see those objectives why I have selected this topic. You might be feeling that since month I'm just taking about the introductory part of homeopathic materia medica, but I really feel instead of taking remedies one after another and one after another, I want to make your foundations of homeopathic materia medica very strong. So that is why I'm emphasizing on this basic topic, on this introductory topic, because in your further years, third year, fourth year, second year, you will learn remedies and remedies one after another, and you will get very less time to study the basic introduction of homeopathic materia medica. So I am emphasizing again on this basic terminologies today of homeopathic materia medica. Now, if you understand this basic terminologies, what will happen, or what is the objective of this learning the basic terminologies of homeopathic materia medica? The first objective, if you know the basic terminologies of homeopathic materia medica, you will improve your understanding of homeopathic materia medica. Now, let me explain what is the meaning of understanding of homeopathic materia medica. Now, I have seen so many students of homeopathic materia medica. I was also one student of homeopathic materia medica. So, in that period when I was student and when I was now teacher, I have seen so many students of homeopathic materia medica, including me. What happens? We become symptom memorizer. Symptom memorizer. Now, what is the meaning of this symptom memorizer? The term I want to convey is that students go on memorizing the symptoms. They mug up the symptoms. For example, they will mug up thirstlessness, pulsatilla, pulsatilla, pulsatilla. And when they will come to know one more drug, they will say, okay, there are two more drugs, apis mellifica, thirstlessness. So this type of memorization, they will indulge themselves in the memorization of materia medica. It sounds very innovative in the initial part, but as the number of remedy increases, it really becomes very, very difficult, because by the time you learn the 10th remedy, you have forgotten the first remedy. So many physicians, so many students have the habit of this symptom memorizing. And there is one more habit of word memorizing. Now, students also memorize the word. For example, the word is Strumus constitution or Strumus diathesis. Now, the meaning of this word is the patient or this remedy has an affection towards the lymphatic glands of the body. So that is the meaning of Strumus diathesis. And the remedy for that is apis mellifica, conium, calcarea fluor. Few more remedies are calcarea iode. Few more remedies are there. But what happens? This word sounds very strange, very new word. So they go on memorizing this word and they remember only the word Strumus constitution. And if somebody asks what are the remedies acting on the lymphatic glandular systems, then he becomes blank. So this is how to improve the understanding of homeopathic materia medica, to go beyond symptom memorizing and word memorizing concept. While study of homeopathic materia medica, one should be very clear about this basic terminologies, and if he is clear about the basic terminologies, he will definitely improve the understanding of homeopathic materia medica. Then one more important objective is, if you understand the Materia Medica, you can improve, you can enhance application of homeopathic Materia Medica. Now, by the time you end up your second year, it is my expectation, or it is the expectation of all the authorities of homeopathy, that you should at least develop some confidence in the homeopathy. You should at least you should start prescribing to some of the common elements, like say coryza, some trauma, very confidently. Otherwise, what happen in second year? I think there are 30 or 53 remedies. You have studied all the 53 remedies, but you can't apply. You can't decide when to give arnica and arnica montana, and when to give ruta, and when to give remedy like Baileys pernis, and when to give hypericum. So if you improve the understanding, automatically it will also increase the application of homeopathic Materia Medica. And in the second year onwards, in your syllabus, it is you are exposed to the homeopathic OPDs, and you are given exposure to the actual case taking. You are given actual demonstration of how the homeopathic remedies are selected. If you have a better understanding, you can apply homeopathic Materia Medica in a better way. Then similarly, to understand the scope and limitation of homeopathic Materia Medica, this understanding of this basic terminology is very important, because in our Materia Medica, hundreds, thousands of remedies are there, and we start feeling that, oh, we are having so many remedies. We are having so many remedies. For example, in allopathic science, for pain, there are hardly 4 or 5 non-steroidal anti-inflammatory drugs. Whatever may be the type of pain, either you have to give the combination of 1 or 2 drugs. But it is not like that in homeopathy, because of the symptom pain. In symptom pain, there are different types of pain. There are different remedies indicated for it, and we might feel that we can treat all types of pain, whatever existing in the world, whatever the patient suffer. And but we have to understand at the same time also that our homeopathic remedies, though there are so many remedies for pain, so if there is a patient suffering from knee joint pain, and there are 100 remedies for that knee joint pain, but unless you give him certain exercises, knee joint exercises, to strengthen his hamstring muscles, to strengthen his quadriceps muscle, and to give exercise to strengthen the calf muscle, your pain remedies are not going to do the complete cure. So one should also be able to understand the limitation of homeopathic Materia Medica. Simultaneously, one should also understand the scope of homeopathic Materia Medica. Now see, the recent pandemic is a good example of understanding the scope of homeopathic Materia Medica. So COVID, coronavirus disease 2019, is a new disease which is first time seen in this 21st century. It was never seen in the previous historical timing. So we can't say that our homeopathic remedies or our homeopathic science do not have any medicine for that. But if you understand the scope, then you will be able to prescribe to any name of disease. So the third objective is to understand the scope and So third objective is to understand scope and limitation of homeopathic materia medica. If you thoroughly know the materia medica, there will be in future time, whatever the name of disease will be there, you can apply the homeopathic science, you can apply the homeopathic materia medica to any kind of new disease. Then one more objective is to study homeopathic materia medica without any prejudice. Now remember, Hahnemann in the aphorism number 6 has said that it is an important prerequisite of homeopathic physician that the physician should be unprejudiced. He should be away from prejudice, and it is not only applicable to the practice, but it is also applicable in the study of homeopathic materia medica. For example, if you remember Arnica montana only for blunt injuries, only for bruises, only for sore and lame sensation, and you have given this Arnica montana to so many patients, and you have found it has good result, and you will go on continuing giving this Arnica montana to each and every type of each and every patient coming to your OPD suffering from the or having this history of blunt injury, having the history of accident. Arnica at the same time is also is a good remedy for fever. It is a good remedy to prevent the puerperal sepsis. It is a good there is a frequent disconnection of the Zoom meeting. Are you able to listen to my voice clearly?
Yes, sir.
Yes, sir.
Okay. So we are studying with fourth important objective to study homeopathic materia medica without any prejudice. It is an important requisite given by Hahnemann that every homeopathic physician must be unprejudiced, and that application of that unprejudiced observer quality is in every subject. So it is also true for its application in the homeopathic materia medica. And we develop certain kind of prejudices while doing homeopathic practice, or even while studying homeopathic materia medica, we develop certain prejudices. For example, I will tell you the Arnica montana is everybody's favorite remedy only and only for sore, lame, bruise, filling, and ailments from blunt injury. But if you study the Arnica montana further materia medica, you will also come to know that it is also good remedy for malaria. It is also good remedy for constipation. It is also good remedy for prostate trouble. It is also good remedy to prevent the suppuration. On the contrary, some of the recent researchers have proved that Arnica montana is the best antibiotic to give after any kind of injury. If you give it, it will prevent the suppuration. So in this way, the study of homeopathic materia medica will become more in an unprejudiced way after understanding the basic terminology. And last objective is to study correlation of homeopathic materia medica and therapeutics. Now, especially with respect to this objective, we have to understand the basic terminology pathogenesis in much detail. If you don't understand the pathogenesis terminology, you cannot correlate homeopathic materia medica and therapeutics. Now, what is this therapeutics? I will also explain you. The homeopathic materia medica is not the name of your subject. The proper name of the subject is homeopathic materia medica and therapeutics. Remember, the full name of subject is homeopathic materia medica and therapeutics. So this is and signifies that there is anything else. There is something is more than that of homeopathic materia medica. And to study and therapeutics, there is an important role of pathogenesis, important role of clinical method, important role of therapeutic method. But unless you understand what is this pathogenesis, you understand what is sphere of action, this terminology, the correlation of homeopathic materia medica and therapeutics will be very much poor. So with this objective, we'll start to study today some of the basic terminologies. So in today's lecture, I will cover these three basic terminologies of homeopathic materia medica. That is, what is the meaning of prover, how it is important to know, and what is information related to pharmacy, and what is the understanding of the term pathogenesis. So first we'll start with the prover. Now, what is this prover? Prover means what? Now, prover means we know that homeopathic materia medica is not a materia medica created out of animal experiments. It is the materia medica created, it is the materia medica evolved out of drug proving conducted on the healthy human being. So the various human beings which participate in this drug proving experiment, they are all called as a prover. But when we study homeopathic materia medica of any specific remedy, there is a name of prover. Now, what does this name signify? This name signify the first prover, or the person who has developed, who has got the first idea of proving this drug. He has conducted certain provings of this specific drug. He was in charge of that whole drug proving experiment, or he was the director of that drug proving experiment. So each and every remedy, you must have studied few remedies. So the first, after in the few introductory part of remedies, the name of prover is always taken. And my dear friend, it is also asked also in your exam. So what does it mean? So there are a number of provers which are involved in the drug proving experiment, and the name of prover mentioned is only the one. So it does not mean that is only this remedy is proved only on a single human being whose name is mentioned in the books of materia medica. There are a number of provers of different age group, different socio-economic background, different intellectual level, both sexes involved in a drug proving experiment. But the main in charge of that drug proving experiment is only mentioned in our homeopathic materia medica. And he is a person who has done the analysis of symptoms after the whole conduction of drug proving experiment. So he has collected the drug proving books, or what is called as the day books from prover. He has studied that day books thoroughly, and then he is giving us some information that this is the characteristic symptom of this remedy, this is the less characteristic symptom of this remedy. So the person who analyzes all the information collected from prover is only mentioned in our materia medica. And regarding this name of prover in materia medica pura, written by Dr. Samuel Hahnemann, if you observe it, that in front of each symptom, name of prover is mentioned. If there are 100 symptoms, there will be name of provers which have conducted that proving experiment. And this is the meaning of prover, or this is the meaning of that bracket in the materia medica pura. And so the prover which we study in our usual study of materia medica is the one prover who was the in charge, who has conducted most of the drug proving experiment, who has analyzed. And also in the materia medica pura, the individual names of prover is given. That is not mentioned in our other books of materia medica. Then this word prover, it also means the important reprovings which are conducted by the different provers. So the continuous experiments are going on in the field of drug proving. So it is not only once the drug is proved and it is included in the Mater Medica. The continuous reproving is done, and the prover who founds the better information, who has given the more information about that specific remedy, it is included as a name of prover. And this name of prover is very much important to give homage, to understand their efforts for the upcoming generation. Now today, now in these days, it is a Pitru Pandroda, and the Pitru Pandroda is known for showing homage, showing respect to our ancestors. And if you know the prover, it matters less. If you don't know the prover, it matters less. But one must know the efforts, the person who has taken maximum efforts to develop or to prove this remedy. So whatever name of prover is there in the Mater Medica, it signifies these three objectives, or these three facets are connected with that name of prover. And it is expected that you must know the name of provers of the remedy you are studying. In orals, it is asked. So this is about the first terminology, prover. Then the second terminology is information related to pharmacy. So after the name of prover, various information which is related to pharmacy is also given. Now why it is given? Because in the olden days, the homeopathic physicians were not purchasing the medicines directly from homeopathic manufacturers. They used to prepare their medicines on their own, and this information is also given to give the accuracy of the part used, of the methods of preparation of that specific medicine. And this information is very much important, because whenever we are studying, whenever we are prescribing that medicine, say for example, we have prescribed Arnica montana, and the homeopathic pharmacy has provided us Arnica mexicana, it will not at all work, and then we will blame the homeopathic science. So this information related to pharmacy, that knowledge is also very important. So this knowledge or this information is given with under different headings. So if it is the medicine prepared from botany, what is the family, what is the species of that family? For example, Naxomica, it belongs to Leguminaceae family. And in that Leguminaceae family, there is also few other medicines. So all this information is given: the family, the species, which part is used, then what is the habitat of that specific remedy, and then the most important is identification details of that specific plant is given to avoid the confusion of similar remedies. For example, there are two remedies in homeopathic Mater Medica, Rus tox and Rus veneta. Now, there is a lot of confusion between the provings of this remedy. In the earlier days, it was thought that the Rus tox drug proving and Rus veneta drug provings are very much similar. But afterward, they have found out that these two species are different. What is their identification is different, and accordingly, these two remedies were the separate remedies were considered in homeopathic Mater Medica. Now, same confusion is with respect to Arnica montana and Arnica mexicana. Whatever drug proving we have, it is of Arnica montana, and what drugs we get from the pharmacy, it is Arnica mexicana. And there are only few homeopathic pharmacies in India. They are providing the original genuine Arnica montana. And unless you know what is this M, whether it is Montana or whether it is a Mexicanum, it is very difficult to study the specific remedy and to prescribe and procure that specific plant and medicine from the pharmacist. Then if it is a chemistry, the classification of elements is given. It belongs to which group, like whether it is acid, whether it is a metal, or it also given as nowadays it has been given according to the periodic table. What is the physical properties, what is the chemical properties, what is the method of preparations, and what are the various controversies which are associated with this chemical which is used in the preparation of homeopathic medicine. For example, Merck Vivus and Merck Sol. Now, Merck Sol and Merck Vivus, these are the two names used in our homeopathic materia medica for the same medicine, that is Merck Sol. So, in some books, it is mentioned that Merck Vivus is a different medicine and Merck Sol is a different medicine. But in some books, they have clearly said that Merck Vivus and Merck Sol, they have the same physical and chemical properties. And so Merck Vivus and Merck Sol are not the two remedies. It is the only one remedy. So such kind of confusion will be avoided if you know thoroughly this information related to the pharmacy. Then another example is Hiparsulf and Calcareous sulf. The remedy Hiparsulf is prepared from a combination of two remedies, that is the middle layer of oyster shell and its combination with that of sulfur. But while the Calcareous sulf is prepared from the combination of calcium carbonate and from the and its addition with its certain chemical reaction with sulfur. So such to avoid such kind of controversies of materia medica, we must be having this knowledge of this pharmacy. Then if it is a biology, biology means related to the animals. The information given will be certain specific genus, certain specific species, and again the identification of that certain species, then the parts used, methods of preparation. And if you understand these things very well, then you can understand that Tarantula hispanium and Tarantula cubensis, even though the symptoms are similar, these are the two different medicines which are prepared from two different animals, from two different habitat. Then information is also related with microbiology, especially when the drugs belongs to the nosodes. You know from your knowledge of pharmacy, nosodes are the drugs prepared from certain bacteria, viruses, and fungi. And their nomenclature is also very much complicated. There are different preparations of the specific nosode. For example, tuberculinum is one of the important nosodes, and this tuberculinum is mentioned in our homeopathic materia medica by 20 different names, like tuberculinum kentian, tuberculinum bovinum, tuberculinum puricum, certain like this. So there are 20 medicines available. If you know this exact preparation, you can come to know which medicine to use properly and what is the symptom belonging to the which name of medicine. And lastly, the active principle. In this active principle, you must be knowing from your knowledge of pharmacy that after the chemical analysis of a specific drug or of a specific drug belonging to vegetable and animal kingdom, it has been found that there are certain active principles. For example, belladonna has active principle atropine, which has all its effect. Then medicine like Rauwolfia serpentina has a active principle Rasparin. Lachesis has a active principle that is a neurotoxin. And this active principles has a lot of impact in the study of the homeopathic materia medica.